Thank you all for being here. I do want to say I always feel bad when things are oversubscribed. So if you are not comfortable where you're standing, we thank you for being here. But if you would like, there is a live stream on the second floor. If you want to stay here, great. You're very welcome. But if you're feeling uncomfortable, there's a live stream on the second floor, and there's probably seats there. But I want to thank you all for joining today for Devex Impact House. This is the second day of the event. Is anyone here yesterday? Okay, a lot of you were here yesterday. Got into a lot of great topics. We've got another great topic today that we're looking at. I'll just read the title here for you. Catalysts for Change, Cross-Sector Solutions for Climate Resilient Health Systems. If that doesn't sound like the event you're meant to be at, you can walk out. I'm Alan Robbins. I'm co-founder and executive vice president of Devex. And I'm really pleased to be emceeing this event today. We've got some great speakers, some great panelists, a great audience, of course. And hopefully we'll be able to dive into this topic and come up with some solutions. So climate change is really a compounding threat, as we all know. You've got the primary effects of climate change, but then you've got how that affects people's health, and then you've got how that affects health systems that are designed to address those issues. There's something like between 2030 and 2050, something like 250,000 people a year are projected to die because of the impacts of climate change. And so clearly, there's a lot we need to do. I'm looking at the audience here. I know all the panelists and speakers and everything, and I think this is the group that can help start coming to some of those solutions. So we're here to get the ideas flowing today. To kick things off in this direction, first off, I want to thank our partners from Takeda for putting this on, and I want to introduce to the stage our friend Takako Oyabu, who is the Chief Corporate Affairs and Sustainability Officer of Takeda, and she's going to just help frame the discussion for us. So, Takako, can you come on up?
What happens when a basin fills faster than it could drain? Imagine trying to stop this overflow with a tiny bucket. Well, that's what climate change is doing to our health systems. Rising diseases, multiplying challenges, spilling out faster than we can manage. Climate action remains underfunded. Less than 2% of philanthropic funding is going towards your climate resilient efforts. Yet every dollar that is invested in climate health action yields a fourfold return. So there's a clear reason for us to action. In today's global aid landscape, which is shifting, we're challenged to do more with less. But I firmly believe that constraints really breeds creativity. And now is the time to think about cross-sector collaboration very differently. Our partners drive community-rooted solutions. When assumptions shift, we encourage them to pivot. Our partners drive sustainable impact. Our multi-year funding keeps them focused on their multi-year mission. Our partners navigate complex challenges. We learn from them, remove our barriers, so we reframe our approach, and we can turn collaboration into a powerful catalyst. Just like the United Nations, climate resilience cannot be built in silos. And this is why we aim to be a connector to bring different partners across sectors to really strengthen health systems, which is a critical step towards universal health coverage. Today, I'm very proud to announce this year's CSR awardees from Takeda. Selected through a company-wide vote, which involves more than 20,000 employees around the world. Please join me in celebrating our new partners, International Medical Corps, the Society of Critical Care Medicines, UNOPS Bangladesh, and Vitamin Angels. Takeda is excited to collaborate and scale tangible impact together to build lasting climate-resilient health systems. By 2030, we aim to advance healthier lives in more than 53 million people in 94 countries with over 200 million US dollars. Looking ahead as we launch for our new request for proposal, we invite bold, innovative, sustainable solutions. So let me leave you with this. Constraints breeds creativity. Creativity becomes a lasting force for impact through cross-sector collaboration. And the time is now for cross-sector collaboration before our basin overflows with challenges. Thank you very much.
Well, thank you, Takako. It's great to have you here, and it sounds really exciting, all these initiatives, in particular these awardees, which I'm sure you deserve a lot of credit and are doing a lot of great things. And now we're actually going to see a short video highlighting the work of these awardees. They're all here. Maybe the awardees can raise your hands, just so everyone knows. Okay. Great, so I'll leave it to the video if we can.
International Medical Corps is deeply grateful to Takeda and its employees for this support. With healthcare needs increasing around the world, it's a tragedy that so many medicines and supplies are wasted because of inefficiencies in logistics and supply. Takeda's support will enable us to bring new AI-powered tools to health workers in Kenya and Somalia so that they can get the right medicines and supplies to the right place at the right time, benefiting millions of mothers and children. On behalf of all of us at International Medical Corps, on behalf of the people we serve, thank you so much for this very generous support.
Many hospitals in sub-Saharan Africa face unstable electrical infrastructure, leading to frequent power outages that compromise medication storage and disrupt life-saving treatments and procedures, ultimately compromising patient care. Thanks to Takeda's generous support, the Society of Critical Care Medicine will be able to bring reliable solar energy installations to hospitals in the West African region and support ongoing biomedical technician training to ensure long-term sustainability. These efforts will bring much-needed clean, dependable energy to entire hospital systems in the region. We are so excited to get started.
The most exciting outcome of the support from Takeda is the launch of Bangladesh's first climate-resilient, fully integrated medical waste system. With Takeda's support, we can protect over 7 million people, train thousands of health workers, and build modern facilities that'll serve communities for years. And we hope that this model that is created could be replicated for many other countries thereafter. Thank you.
Thank you, Takeda team, for selecting Vitamin Angels. Climate change hits pregnant women and children the hardest. In Indonesia, 1 in 3 women in reproductive age face anemia, and over 30% of children are stunted. Together, we'll prevent those devastating effects in 12 million women and children by improving nutrition policies, supply chain, training healthcare professionals, and directly impacting those women and children with nutrition interventions. We will do this in partnership with governments, and thanks to your help. We are really excited to start this partnership and create lasting impact.
That's great, and I love the fact that it was the employees that voted on this. So it really makes sure that everyone's engaged in these great causes. Well, thank you to Takako and to Takeda for that. We'll start with the meat of our program today. And I want to invite to stage Dr. Peter Singer, who's going to be our moderator for the next session. Peter is a professor, among other things, professor at University of Toronto, or emeritus, I think. He's got several different professions now. They semi-retired, and I learned last night one of them is skiing. So that it's great to have. So Peter, come on up.
Thank you very much, Alan. And I'll just invite all the panelists to come up too while we're at it. Welcome, everybody. How are you doing out there? And great. And right in the back there, I see you're at the bar. What are you drinking? Coffee. Okay, good. Listen, raise your hand if you think that climate and health is a problem. Okay, great, because what that means is we don't have to actually spend any time describing the problem. One of the kind of frustrations in this field is that people love to spend all their time talking about the problem, and where we're going to focus in on is solutions. Raise your hand if you have a specific solution that you're going to want to talk about in the discussion period. You get the point? So just for the people online, I don't know if you can see the audience, every single person in the room here, and it's kind of overflowing, raised their hand on is climate and health a problem? And in terms of have you got a specific solution, there were like, what, 3 hands, Claire, or 4 hands or something, and they were very tentative. Everyone shot up on problem, and like solution was. So that's where we're going to focus, because that's actually the gap that we need to fill, is find specific solutions at the intersection of climate and health. Because that intersection can also be kind of wishy-washy. So the specific solutions really help to focus the situation. And not only that, but those solutions need to be financed. And so we're going to focus on that as well. And we've got a great panel that's going to help us to do that. And we'll get to them now. And I'm going to introduce them as we go. But you've kind of got the game plan now, right? Anyone have any questions before we start? Okay, great. So let me just start then with Jada McKenna. Jada, you're the CEO of Mercy Corps, and you'll meet all these fine people as we go along. Jada, you're the CEO of Mercy Corps, and you've got a very specific solution that Mercy Corps is executing on in the area of resilience. Can you tell us about that?
Yes. Thank you so much, Peter, and thank you everyone for being here. Like we all know that our lives are complex, and in building resilience, there are a lot of different things that come into that. And in emergencies, the climate resilient hubs, the resilience hubs that I'm going to talk about, were really born out of the devastating hurricane that hit us in 2017, and specifically started in Puerto Rico. But it really follows along like well-trodden paths. So when an emergency hits, the first person that people turn to are their neighbors, like they need the immediate help. And so one of the things we're really trying to do is to put communities at the centers of their own recovery, to really equip communities to support one another in periods of disaster or emergencies, and bringing the knowledge that we have from being emergency responders to those communities. So we started in Puerto Rico building a series of resilience hubs, so places in the community where people could go for education, like basic health checks, but they also know in the event of emergency there will be reliable electricity, there will be water systems. First responders can go there to do things, and that brings in a whole network of local organizations and local partners, and just becomes a grounded part of the community. So we, throughout the Caribbean, we've set up about 200 of these systems. Puerto Rico has the most number, but in Jamaica, St. Kitts, Nevis, St. Lucia, and have a really deep network of local partners in each of those places that really coordinate and do services and do normal programming in these community hubs. So that really allows organizations and communities to do, we call it anticipatory action. So to really know that something is coming, to be prepared and to help people in their times of need. So since the hurricanes, those hubs have helped people through floods, through heat waves, even through COVID-19. They were a really important source of connectivity and access. So we're really excited about these resilience hubs, and just it's a great example of really building solutions within communities.
And that's pretty cool. And what's your vision of success? Like, how do you know they're working? What are the one or two metrics, or what does success look like?
Like every community defines success for itself, right? But for us, it's, I think in the hubs more broadly, it is, are people, did it have what people needed at that time, the number of people served? And then when you go back and talk to participants or community members who participated, them being able to say, I was less impacted than I was last time. That's the ultimate measure of success.
Okay. Cool. Lois Pace, you're the regional director for the Americas in IFRC.
Yes.
And you've got a specific solution. Most people don't think about what Lois is going to talk about in relationship to the intersection of climate and health, but it really is, I think, a very important channel. And I'd encourage you to think about these as solutions pathways. Yeah. So one solutions pathway is disaster and resilience. One solutions pathway is what Lois is about to talk about. Yusuke has another solutions pathway, because at a very minimum, you can't really evaluate, you can't really see what success looks like without knowing which of those pathways you're in. So now we're going to hear about one that you might not associate with climate and health, but it's very central, actually. Do you want to tell us about your example, Lois, of a concrete solution?
Pretty incredible setup. I hope I can deliver. So, hi, folks. As Peter was saying, I'm now at the International Federation of Red Cross, Red Crescent Societies, but many of you might know me from my many years in the health space, so it's good to see friends again. And, during that time, even before I started working more in the humanitarian field with people like Jada and others, I was always working to try and make this link, right, and ensure that we were working at the intersection, which is really quite hard, but it's really great to see this room so full of people who are trying to do the same thing, so thanks for that. In and throughout the Red Cross network and around the world, not just in the Americas that I cover, we're responding to disasters every day, and by we, I mean our network of community-based volunteers. And when you think about Latin America and the Caribbean, there is something happening every day, unfortunately. Jada just talked about hurricanes. We're in hurricane season, right? And these events are getting harder, not just to manage systemically or logistically, but individually. So think about, for example, Hurricane Beryl that hit the Caribbean last year. Hurricane Beryl was a Category 5 hurricane, which is already bad enough. It also happened in July, which is not a thing that happens. You also consider the number of storms and potential hurricanes that are hitting not just the Caribbean, but Central America, again, every season at this point. Think about the floods that are impacting other parts of the Americas. Think about the fires here in the US or in Canada, right? And those are things that I'm dealing with in Latin America too. And so with each of those events, there's not just grief from loss of livelihood or economy or life, but there's anxiety about what's to come. And so by working with and talking to our volunteers on the ground, we learned that we really had to focus on the mental health component as it relates to these climate crises. Folks who are bracing themselves for the next thing. And so, for example, I was in the Caribbean just this July, sort of recognizing or acknowledging the anniversary of Hurricane Beryl, and I was talking to fisher folk who were saying, look, I don't know if I want to go back out in the water because that was so scary, So it's really important to think about this intersection, particularly with mental health, because people have to get on with their lives, people have to go back to school, people have to go back to work, people want to live and thrive. And so we have been working to develop, for example, courses in psychological first aid. So we think about sort of an acute response, right? You think about an earthquake, you think about anything. And it's really important that obviously we deploy people in this way, but it's also important to have therapists, counselors, other people who are equipped, including our volunteers, in sort of this basic assessment of people's mental health and understanding what sort of additional care they might need in the short or even the long term. We even have as part of our surge teams, right, as we're planning for a climate disaster, people who are equipped to work in this way. So not just logisticians, right? Not just people who can sort of move products throughout the supply chain, but also, again, people who can sort of conduct these community and individual assessments about that risk and about those needs. And so for me, it's been very powerful to work in this way. It feels very palpable to people, and it's not something we often talk about, like you said, Peter, but it is truly touching lives to consider their very personal impact. And as someone who grew up with earthquakes myself out in California, right, or who had family who were in Katrina, like, I know how important this is. And I'll say even beyond the people who are affected directly in communities, we're also focused on first responders. I mean, think about 9/11, think about the Indonesian tsunami, think about the Haiti earthquake. People were really affected by those things, the people who found those bodies, the people who had to respond. And so really working with responders as well in their own recovery is really important when we think about how frequently these disasters can take place and how often they'll need to be deployed.
It is important. And give us a sense, Lois, of scope and scale and geography. So what does this actually look like?
Well, I mean, goodness, we're already up to 30 or 40 responses that have sort of triggered our support as a federation within the Americas. And we're just, we're not even through the year yet. So I would say, just to take more specific examples as well, we had a number of floods in Venezuela this year. And so similar to what Jada described, what we try to do is not just respond on the back end, but think about what people could be experiencing on the front end through anticipatory action. And so as part of our planning for the floods in Venezuela, as well as other floods that were happening in Ecuador, Colombia, and elsewhere, we did have this sort of psychological component in an effort to support people in however they needed.
Great. Thank you. I'm going to go to Yosuke next, and then Hunter, I'm going to come to you for the, what do you call it, the last batter? What do you call that, Alan? Yeah. Home run hitter. Oh, the home run hitter, okay. So, cleanup hit, that's the word. So Yosuke Kita is the Director of Global Health Strategy for the Ministry of Foreign Affairs in the Government of Japan. And Japan obviously has a long-standing signature in universal health coverage, as we heard a little bit about from Takako as well. And you're going to illustrate kind of another solutions pathway in terms of the work that you've been doing, the work you've been supporting. So please, go ahead, Takako. Go ahead, Yosuke.
Yes, thank you very much. I would like to introduce myself. I'm now working in the Ministry of Foreign Affairs, but originally I'm a medical officer in the Ministry of Health of Japan. So I have been working in a public health field in more than around 20 years. And actually, the climate change and health remind me of our incidents in 2014 of local transmission of dengue fever. And when we experienced local transmission of dengue fever for the first time in decades, right in the heart of Tokyo's Yoyogi Park, which is a very famous one, this was a wake-up call for our public health system. Since then, we have strengthened surveillance at both the national and the municipal levels and introduced mosquito control measures in public spaces, and built rapid system for information sharing and public awareness. And local health authorities now routinely monitor the spread of mosquitoes and remove bleeding sites and carry out community education. But climate change does not stop at national borders, and diseases like malaria and dengue are likely to expand their reach. That is why Japan also invests internationally through contribution to the Global Fund and Gavi to support the prevention and vaccination and access to tools in high-risk regions. And vaccines are particularly important part of our strategy. And we have a long tradition of producing most of vaccines of our national immunization program domestically, but declining demographics. For my age, we have annual 2 million births a year, but now we have less than 0.7 million births a year, so dramatically decreasing of the population. So that means that by engaging internationally, for example, with vaccines for Mpox or dengue, we not only strengthen global prevention, but also maintain domestic vaccine capacity, and which is itself part of national health security. And finally, Japan joined the WHO's Alliance for Transformative Action on Climate and Health last year. And we see real value in connecting domestic lessons with global partnership and linking surveillance, vector control, and vaccination, and innovation to minimize the health risks of climate change through the collective action. Thank you.
Great, thank you very much, Yusuke. So you get the idea. This is another channel. This is vectors, mosquitoes, et cetera. This is the case of dengue. Vectors get worse with climate change, and dengue gets worse. It's actually extremely common in Southeast Asia, Latin America. What I find really interesting about this area is there's actually two concrete solutions. There's the vaccine, super important, and there's also dealing with the vectors. You know, this idea of putting the Wolbachia into the vector so it doesn't transmit dengue. And that's a thing. And it's actually now proven, it's scaling, and there's a project that's getting started that Devex wrote about in Indonesia, the Asian Development Bank and stuff. So this is a very concrete solution and a very specific area. Also implicates malaria, but dengue is like a big problem. I think about it almost like as the influenza of low and middle income countries, really of the world. The first time you get it, it's like influenza. The second time you get it, it's really bad. You can get dengue, hemorrhagic fever and stuff. And so it's interesting. Climate change, vectors, two specific solutions. I think an area to watch, a lot of concrete stuff, and a lot of stuff around financing. I was really interested when you said that you were funding Gavi to work on your domestic vaccine industry. And that's a good example of how this kind of artificial distinction between domestic policy and foreign policy breaks down, which I think will be really important when we're talking about an X-first world, whatever country you want to fill in as X, because these links between domestic and foreign policy are super important. Anyway, Hunter, you're Hunter Lovins, you're the managing partner of Now Partners. And you're going to focus more on the business side. You've been working with large companies, among other things, watching eagles fly in Colorado and other things like that. And can you tell us a little bit about the work that you've been doing? We'll start with the first company we were talking about and give us a little bit of that concrete example.
Sure. For those of you who didn't put your hand up with a solution, it's real easy. There are two. End the use of fossil fuels by switching to renewables, which is everywhere cheaper. And two, regenerative agriculture, which pulls the excess CO2 out of the atmosphere, puts it durably into the ground where it becomes a nutrient. You have a solution now. Corporates are frequently desperate for, what do I do? What can I do? It turns out implementing things like renewable energy, and particularly energy efficiency, is just cheaper, better, faster. So Baxter Healthcare, some years back, said, we're struggling with how can we justify spending money on more efficient light bulbs, on more efficient heating, ventilating, air conditioning. Can we get a one-year payback? And a man named Ron Meisen, who ran sustainability for Baxter, said, we're looking at this the wrong way. When you implement efficiency, you get a saving the first year, and that's counted as your ROI. But you get a saving the second year, and the third, and fifth, and 50th. We ought to count the growing savings against the ROI. When you do that, renewable energy, energy efficiency simply is a no-brainer. So they did, and they shifted how they do their charts of accounts to count this growing saving over time. I worked in Afghanistan. We had an opportunity, we the world, a few years back, to build green Afghanistan. The Afghans wanted it. USAID wasn't so keen on it. And sitting in a meeting with the then young head of the new phone company, Roshan, he said, we're going to put cell towers around. I said, when you do that, power them with solar. If you put solar in a village, now you can have a refrigerator, you can have vaccines. Afghanistan's one of the few places where polio is still rampant. Put a computer. Now you can do telemedicine. Train a woman as a midwife. 1 in 20 women died in childbirth. 1 in 4 children died before the age of 5. This is wholly preventable. Train someone as an EMT. If they can't solve it, they can get on your phone and call Kabul and get a helicopter launched. I left Afghanistan in 2006. All the US wanted to do was diesel power, and thought I'd broke my teeth. Sitting in the back of a lecture hall listening to a Harvard Business School case about how Roshan, the national phone company of Afghanistan, put cell towers powered by solar and did telemedicine and cut in half the number of children who died before the age of 5. And I sat there with a tear dribbling down my face going, I did that. Sometimes what you say can make an enormous difference.
So I think that's good, Hunter. So I'm going to come back to the other example, I think, in the second round. That's you've reminded us that these channels, whether it's disasters and resilience hubs, mental health and psychological first aid, vectors and vaccine, or dealing with the vector directly, the solutions, you've reminded us that that sits within this problem of energy. And healthcare is, I think, about 5% of greenhouse gas emissions, but each of those facilities has an energy need, and you were speaking to that, and you were speaking to that in the context of Baxter as well. So what I want to do now is pivot a little bit. We've heard 4 concrete solutions, 4 or 5 actually. Hunter gave us a couple, and I want to pivot and focus on how to pay for these solutions. We're in an era in global health that's a bit, I don't know how you would describe it. Anyone have a word you'd like to use for it?
Not a safe one.
Maddening.
We got maddening. Let's use some words. Schizophrenic. Dumpster fire. Any other words on the current era of global health? Free fall, unpredictable. Okay, you get the idea. It's kind of choppy seas out there. And one of those North Stars in those choppy seas is finance and how you actually finance these solutions. And so I want to zero down on that question and come to some concrete ideas of financing climate and health solutions. And then we're going to come back to Hunter at the end for a little bit of a riff on leadership. Because without leadership, there's no finance, there's no solutions, there's no nothing. So Yosuke, can I start with you? Japan did a very interesting thing in terms of finance. And now we're talking about very specific upstream finance, R&D. And you've got a specific example of that.
Yeah, thank you very much. So yeah, actually, especially for this week in Anga, whenever I met with old colleagues in the global health context, we usually talk about global health financing was in danger because of this situation, and financing is absolutely critical. And the public budget alone are no longer sufficient to address the combined challenges of health and climate. And mobilizing domestic resources and private capital and philanthropy is becoming more important than ever in these days. And we have been experimenting with such partnership. So as Dr. Peter Ginger mentioned, that we have some experience at new innovative financing for the R&D. So through the UNDP and GHIT collaboration, Global Health Innovative Technology Fund collaboration, we have supported research and development for new medicines against malaria, tuberculosis, and neglected tropical diseases. And this model brings together governments and foundations like the Gates Foundation and companies, including the Takeda, to move products from research to delivery. And similarly, through Gavi, we work with CEPI and UNICEF and private actors to strengthen vaccine development and manufacturing. At the same time, sustainability is not only about raising more money, but also about avoiding duplication and ensuring the public, private, and philanthropic resources complement each other. So we are still in the discussion of how we can streamline the Gavi and Global Fund activities under this, the health financing, in dangerous situation. So, but this coordination is essential for building a resilient health system capable for responding to climate shocks. And philanthropy in particular plays a catalytic role. And we know the history which shows how private giving has often shifted entire fields of public welfare. And today, corporate philanthropy can drive innovation. For example, Takeda's, we had a conversation with Takeda's colleagues at Takeda's endowed professorship at the London School of Hygiene and Tropical Medicine. And these kind of initiatives brings new ideas, new partnership, and new talent into the systems. And from the government of Japan's perspective, we highly value such kind of collaboration. We will continue to invest through multilateral institution and partnership. But we also encourage corporate philanthropy to engage, not just in short-term project, but in long-term systemic strengthening of climate-resilient health system. Thank you.
Great, thank you. So, okay, so we actually have 3 examples of finance on the table so far. The first one actually Takako gave us, which is CSR, and that's a form of finance, philanthropy, corporate philanthropy, and you mentioned that as well. The second example is R&D finance, which is the GHIT example, which is a mixed public-private, but upstream R&D and innovation super important in those choppy seas. And then the third example is procurement, because you mentioned Gavi and Global Fund a couple of times, and those are kind of pull procurement. So I'm just kind of sketching the concrete examples at the intersection of climate and health finance. And then I want to come to you, Jada, and you're going to talk a little bit about from the perspective of Mercy Corps and INGO, how does climate and health finance look to you? And please feel free to add to those examples.
So we work with communities to build resilience, and especially with populations that are particularly vulnerable, and making sure that they're prepared with the resources that they need to thrive. So in East Africa, especially, the Horn of Africa is subject to so many droughts, recurrent droughts, and there are like many farmers and pastoralists who really rely on water for their livelihoods, to get food for their families, to pay for healthcare. In fact, similar to the U.S., like a health catastrophe or a broken bone could be really disastrous for a family in East Africa in a drought-prone area. We know so much more now in terms of satellite systems and weather systems that we've been able to really develop and work with companies to help deploy micro insurance products that also allow people to take charge in anticipatory ways. So when a drought is predicted to come, there's some automatic payouts that people can get from these really relatively inexpensive, affordable for their budgets, micro insurance products to protect them in case of crop losses, or early warnings to maybe tell them now is the time for me to cull my herd before other things happen. And so the beauty is really and I think this is a role that international NGOs especially play, when you can take like products and services and technologies that may become prevalent in other parts of the world and adapt them to the needs of communities in faraway places that we serve, and make them affordable. But also, we also continuously study the unanticipated consequences of these things where there may be negative after effects. So just continuing to tailor things to people's needs so that they can really take the lead to get what their families need when these emergencies happen.
And Jada and maybe Lois, you want to pick up either one of you guys, because I know you've got a similar example. And I thought this was very interesting. I had you guys heard about microinsurance in the context of disaster, in the context of climate and health, in the context of an INGO before? That one was new to me. Maybe everyone's heard about that, but I thought that was a very interesting kind of financial model. So I want to dig into a little bit more. Like, who holds the risk there? Is that like Swiss Re backing up Mercy Corps, and do you get reinsured by Swiss Re or backing up IFRC, or is it like totally a public fund? Where do you get the actuary? Just take us one level of detail. And I don't know, Lois, if you want to jump in.
Sure. I mean, in our case, so we have a similar model, but I think it's a bit more macro level. So we have just to back up, we have the Disaster Response Emergency Fund, the DREF, that I think a number of people are possibly familiar with. I would rather name it in some ways the Disaster Resilience Emergency Fund, because similar to what Jada described, in Mercy Corps' case, we're not just using it for response, but we're also using it in anticipatory fashions. And in our case, we have 191 Red Cross societies or Red Crescent societies all over the world. And they qualify, or they can apply to this pool of funds that we have available. Last year, we distributed or allocated about 85 million Swiss francs for about 170 operations to about 100 societies. So that's sort of the scale of this work. And in some cases, they knew a volcano was going to erupt or a drought was, imminent. And so they were able to, again, in an anticipatory way, based on very clear protocols and triggers, really come and say, okay, we think we'll have these needs, or we think we want to provide these services, including cash voucher assistance or in other ways to sort of bring the power to the people financially. This is what we require from this pooled fund. And what we did, interestingly, a few years ago, before I arrived, was we actually worked with the private sector to insure the fund itself. And so instead of having individual insurance sort of packages or schemes, policies, the fund itself is backed by a company or companies. And so then that way, as that original pool of funds is drawn down, and that original pool is sort of a traditional donor model, right? But if we get hit really hard, like we did in 2024 with a range of disasters, then that insurance can kick in so that those funds remain available and aren't fully depleted. In that way, there isn't a delay sort of, in the latter half of the year as disasters come, or if there's sort of a major event that we don't actually have the resources to cover.
So you got a deductible, like on your car insurance.
And in some cases, even corporations or private sector partners are paying the premium of that fund as well.
Cool. Anything else you want to add to that, just briefly?
Part of working in communities is working through the entire ecosystem. So we do work with a lot of local financial services providers. There are things we may be able to bring in, like a first loss guarantee or other things to like give them proof of concept that this is a product that won't bankrupt them. And also sometimes like corporations or not corporate, like smaller, like maybe the stockist in the community or something has an incentive to bundle it in to give people an incentive to buy a better seed. Or there's a really working to make sure these products are really locally available, locally tailored, and sustainable.
Okay, cool. And none of this works without leadership. And so, Hunter, you're going to briefly give us an example of leadership, and then we're going to go to the audience, and I'm eager to do that. Let me just see, is John Fairhurst still there? Is he hiding in the back there? He was here before. Okay. Go ahead.
Do that, but a cautionary tale. There, brilliant piece in LinkedIn by a man named Gunther Thallinger, board of Allianz, who said, entire regions are becoming uninsurable. No government will realistically be able to cover the damage when multiple high-cost events happen in rapid succession. Said this is a systemic risk threatening the very foundation of the financial sector because lack of insurance means other financial services become unavailable. This is a climate-induced credit crunch. Climate damage cannot be insured against, covered by governments, or adapted to. That means no more mortgages, no new real estate development, no long-term investment, no financial stability. The financial sector as we know it ceases to function, and with it, capitalism as we know it ceases to be viable. Now, a wag then wrote in and said, how about people?
Yeah, that part.
Oh, that part. A lot of the solutions work in the short term. They do not work if we don't solve the climate crisis. And again, we know how to do that. I had the great privilege of working with Paul Pullman at Unilever. Paul was a leader. Within a week of being put in as CEO, he said, we're not going to report quarterly. He said, and stock dropped 10%. He said, to those of you who sold, I value you as a human being, but if you think I can best manage your asset on a 90-day rotation, I don't want you as my owners. Under Paul's tenure, stock revenues grew 300%. Since Paul left, in the 7 years, they've grown about 6.8%. Do the math. Paul's commitment to sustainability, to improving the lives of 1 billion people, grew financial value. Notice, no polar bears required. This is simply better business. And while Paul was the CEO, 3G, the predatory investors came around. We want to buy Unilever. Paul said, it took him all of 24 hours. He said, no. I mean, what? This was great for the shareholders. Until you take a look at what 3G did to Kraft Heinz, whom they had done this to before, they raided the company, they fired a lot of people. Yeah, they drove short-term stock value. Until Kraft Heinz got dismembered as a company, and they had, I think it was an $18 billion write-down. Now, if you look at Kraft Heinz, they're being dismembered, they're separating Kraft from Heinz. Paul did what we call regenerative value creation. And he noticed that when he came in, the 14 brands at Unilever that were purpose-driven drove 50% of Unilever's growth. This long-term vision, and Japanese companies are good at this. There are 1,000-year-old Japanese companies. How many companies can you name in this country or in Europe that are 1,000-year-old companies? Taketa's what, 240 years old? How do they make it that long? Values, commitment, and leadership. This is just better business.
Great. Thank you. So we've heard, that was great, Hunter, and that's a great way to pivot to the audience now. We've heard about concrete solutions, disaster hubs resilience, mental health, vectors and vaccines, the energy situation. We've heard about different financial models. I won't list them all again. Would now like to hear from you. I mean, obviously, feel free to ask anything, say anything, but would be great to hear specifically concrete solutions. You know, the problem with climate and health is it can be very frustrating because everyone spends all their time talking about the problem, and then they talk about the solution in generalities. We haven't done that today. We've got actual concrete examples, both of the solutions and of the financial backing to those solutions. So let's continue in that vein and hear any examples from the audience about specific solutions that you had, maybe starting with the tentative hands that went up at the beginning of the show. But obviously feel free to ask anything, but would love to hear about solutions. Please, go ahead. And I'm sure everyone here wants to hear about solutions because we saw in the poll at the beginning that what we're dealing with here is a massive solutions gap. So please, just introduce yourself, stand up maybe,
Sure.
introduce yourself, and tell us about your solution or anything
everyone.
else on your mind.
Sure, my name is Sunny Patel. I'm at the Harvard Humanitarian Initiative, and we have some solutions, being an academic partner and practice partner for many different groups working in fragile health systems around the world, and some of the groups that Mercy Corps and IRC we work with. And I think the question I wanted to bring to the solution is what we continually, where our partnership comes in, is thinking about how do we measure the solution? So we found a solution. We see that it works, but as you know, to make it sustainable, we have to have this evidence to back it up that the implementation is actually measuring or doing the solution that we want, and it can be sustainable, especially in fragile areas where resources may not be quick to recover in times. So my question to the panel is, what are some advice or some tools that you found? And I'm not going to self-plug things that we found, but we can talk to you later about stuff that we found that could share with the solutions of where we're thinking about some of these implemented sciences that we have found.
Great, and how do they find you if people want to follow that up?
Sure, at hhi.harvard.edu.
Okay, great.
Thank you.
Thank you. So we're going to keep that on the table, but I want to keep sampling. Yeah, in the back there. You've been drinking coffee or whiskey? Water, please go ahead.
Hi, everyone. My name is Elena Atava. I'm with AmeriCares. And I have a comment to contribute, but I really would love to also hear from our speakers anything else around people helping each other. Because at the end of the day, we're going to be so overwhelmed, nobody's coming. And so how do we support communities, whether it is to pool funding, whether it is to teach basic skills, whether it's survival during heat waves or floods, how to support each other. We know community members are the first responders because they're right there. We recently worked with the Department of Health in the Philippines to develop a toolkit, and it did focus on healthcare facilities, but the Philippines community really demanded a community part of this. And of course, the Filipino society is very, community-oriented, so it made sense. We really focused on that. What do people need to know? Let's say you're a worker working outside during heat waves. Your coworkers need to know how to provide first aid during heat stroke because you're probably not making it otherwise. So I'd love to hear other examples of how we support each other, what organizations are doing to advance more of that, because I think that's the future for all of us.
Great, thank you. So we've got metrics, we've got communities. There's a question right in the back there. So we'll take the one in the back, the one there, the one here, so 3 more, and then we'll come back and then we'll close. Does that sound about right? Anyone have a burning, pressing question other than those 3? We'll take you 2. So one in the back, there, and then there. See what happens? But that means you got to be quick, because now we've got 6 people and 9 minutes, which means like really 30 seconds per. So fire away.
Yeah, I'm Michael Knudsen with the Syrian American Medical Society. So one thing that we're doing is working on community surveillance. We have a big problem in particularly in northeast Syria with cholera. So as the health system, is still pretty non-functional and has been since 2019, we've been doing community surveillance with community health workers, and now we're starting to think about how we can actually just train, regular community members, not even health workers. So I'd be curious, if others have similar programs in other countries addressing kind of the zoonotic and infectious diseases.
Thank you. So metrics, communities, training. Please go ahead. Yeah, in the red tie.
I'm barely able to stand, so I hope. Okay. So thank you so much. My name is Yusra. I'm from Pathfinder International. I think the problem is very complex, that it cannot have one solution. So the solution has to offer multi-level community, healthcare workers, surveillance, and healthcare facilities. We at Pathfinder have started doing some work on, I'm sorry, I'm really tired, but I really wanted to answer your question. So the solution we have addresses all these 4 components in the MENA region with a program funded from the Green Climate Fund. So when you talk about surveillance, for example, it does not start or stops at health issues. We have to talk about agriculture, we have to talk about the water, we have to talk about the environment and having integrated systems that actually connect all these aspects, because all these communicable and non-communicable diseases starts there. And later it goes to humans. So you need these systems that have the ability to track and detect these diseases before they become communicable to humans. And you need the community to have this event-based management system. You need the doctor who sits at the clinic in some rural villages to be trained in actually reporting these diseases as climate causes. And you need the infrastructure to be resilient enough to withstand climate change. So it's an integrated solutions at various levels.
Thank you. So we've got 2 or 3 community integration training and red tie. Can you give the microphone to the red tie guy there, please? Because we have the red tie guy, and then we have 2 or 3, you, and then...
I'll have to think about myself that way from now on, right? Robert Newman, I'm Executive Director of AMP Health, a South Africa-based nonprofit supporting development of public sector leadership and management capacity. I've heard a lot this morning, both in this wonderful panel and in the other one I went to at the Pandemic Action Network and the elders, about leadership and the importance of leadership. But I think we're sort of guilty of magical thinking. The leadership's not going to happen by accident. We have to invest in the development of leadership and management and coordination skills at country level, particularly at this intersectional thing, which is even more complicated leadership. So how are we going to really stop just dreaming that leadership's going to happen automatically and realize that that's going to take a concrete investment and it's going to take time, and that we need to figure out how to get leadership across sectors to work together and develop a shared leadership vocabulary. And again, I think we need a coalition of partners willing to invest in the development of that leadership. Thank you.
Thank you, Rob. So you can't point to a great example right now.
No, I can't. We're starting that work. I mean, I think what we're just getting going doing some of this work in Nigeria, and the idea is how can we get a coordination platform team together? There's good examples in maternal and child health, how that's been done, where you bring people together across a range of disciplines, different ministries, and I think it's building off how we've done that elsewhere and help these groups to translate global ideas into country action plans.
Thank you. So we've got just 2 or 3. I think we've got, 1, 2, 3, and then we're done. So really just 45 seconds if you can.
Great.
Thanks.
Lisa Tarantino, I'm a health systems consultant. I'm going to talk about work I did in my previous life working as a contractor to a certain agency. One word that I was really surprised we didn't hear so far is migration, because when I think about health and climate, particularly in Latin America and the Caribbean, migration is really intrinsically linked. The 2 countries that I'd like to cite in terms of recent successes, one is Colombia, where, and there's an economic and a human and health imperative of integrating migrants, but also codifying a method of surge support along with financing. So they have from the national to the subnational to local levels a plan and a tested methodology for surge support. The other country is Peru. Again, economic and health imperative of a policy, a law, that explicitly gives migrants right to health care in certain priority infectious diseases. And so I guess my question is more about the health system and sustainable approaches.
Thank you. And then we've got right there. Yep. Please go ahead.
Good morning. My name is Ornisha Watson. I'm from the Bristol Myers Squibb Foundation. But I'm attending this event with the hat of Ornisha, country girl from Jamaica. And really, my solution is that there needs to be more Ornishas in these conversations. Far too often, I'm here at Climate Week, and there are organizations that represent people impacted, but not often do you see those people in these meetings. I was just in Jamaica and can attest to Loy's comment about Beryl and the impact it had on my hometown. You know, their homes that are still, there are people so traumatized that they have their windows boarded still since Beryl. That is trauma. Imagine living in your house for a year with the windows boarded because you saw your neighbors and everyone else's house destroyed by hurricanes. So I really wish that part of the solution is that you have these folks in these rooms. I know a lot of you do great work with them in the local context, but I rarely see us in these rooms.
That's a great point. Thank you. And then finally, yourself.
Try to be quick. So Dalali Atipo with Drugs for Neglected Diseases Initiative. I'm the North America director. Very important discussion that we've had here today. So in terms of climate and health, earlier you mentioned the importance around vaccines and vector control, especially as it relates to dengue. I think an important approach we also have to integrate into that is therapeutics. And especially with the rise of dengue in particular, and looking at advanced dengue, we cannot talk about those who are just initially getting it. We ourselves within DNDI and with partners through a Dengue Alliance, from folks who are involved with our partners from Malaysia to Thailand to Brazil, we have a phase 2 that's coming into clinical trials to really be able to develop solutions for those who are progressing as well with advanced. So I really wanted to add that component.
Great, thank you. So what I heard, just to summarize all those questions and comments, I heard something on metrics. I heard 2 or 3 reinforcements of your community theme. I heard a couple of reinforcements of your leadership theme, plus the representation point, and you would, I'm sure, throw in young people there, and then a little bit of embellishment on vectors. What I wanted to do, just in light of the time, is just pick up the one that I think we haven't really tackled, which is the metrics, the M&E. We've really got very little time, but is there someone who wants to say something for 15 seconds on M&E? It's not one of the ones where everyone has to say something, but if there's... Jada, you get the baton.
Yeah, it's really important, I think, to involve the people who are receiving the services or participating to really help set what those metrics can be. You know, a lot of us have been forced to set, like, to work with donor priorities or like numbers things, and in so many ways that ignores a lot of how people's lived experiences and the things that they find most important. So creating systems where our metrics are really driven by the people that will be impacted is quite important.
Great. Okay, so I think we're going to wrap up now. I just wanted to provide one more concrete solution before we did that, and want to change my hat a little bit and say, oh, I've got a revolt here. We'll come back then. So just want. Go ahead, Lois.
Yeah, I'm like, look.
I did say we weren't coming back to panel, but go ahead.
No, thank you. I appreciate that. No, I just really want to leave space for the comments on community, because that's why we are here, heard for sure. So some of this is the nature of this convening. We have an Amazon Alliance that involves indigenous communities who are living and working in those communities who we're trying to bring to COP. Pray for us. We also, it relates to the question that was asked in the back about who shows up, right? Like, I mean, that's the thing. Like, we got us. That's our reality. As everyone else falls away, as everyone else unfortunately loses their jobs or loses their funding, and you turn to the left, you turn to the right, and it's just the people in communities. That's what I love about Red Cross. Of course, I'm biased. I work here now, but volunteerism, right, is how, I mean, we all remember having to check on the person down the street or make the plate or make sure someone's taking their meds, like the basic stuff that we need to continue to foster in communities. That's natural for communities, especially in these times where they are concerned. They know nobody is coming to help them. So this is why we're here. This is what I do every day, is I work and talk to these people. And look, I'm the only American out of the 200 people who report to me. Like, and so that also matters for me, right? There are people who truly are living and breathing this work because they know it firsthand, and so know that that is something that is that motivates me. So thank you for letting me come in. Also, migration is going to be brought up in another panel later today.
I think we're going to wrap it up, Hunter.
Peter, 10 seconds.
Yeah, okay.
That exact philosophy applies to all climate solutions. Check out www.copx.global. The solution to the climate crisis is in every community, and empowering the people there to implement the known solutions in their own way. That's ultimately the answer. copx.global.
Great. And oh yeah, sure. Why not?
So 15.
Anyone
15 seconds.
want to stay for lunch?
For the, metrics and monitoring evaluation of the one intervention. I would like to focus on the vaccine. So I was in charge of the national immunization program when we introduced the HPV vaccine in 2013, and at the time that we had a very strong pushback for the HPV vaccine introduction. So we stopped recommendation in 2013, and we resumed recommendation in 2022. The 9 years loss for the immunization, and we have the cervical cancer deaths annually 3,000 deaths. So I think as for the vaccine, we can see how many cases are preventable and how many deaths are preventable. So that's one good example for the metrics. Thank you very much.
Okay, good. So we're going to conclude. I'm not going to try and summarize. I'm going to thank these guys in a second. See, the music is on. But what I wanted to say is in terms of community solutions, here's a concrete thing. Grand Challenges Canada, where I have a conflict of interest because I used to be there, Science for Africa Foundation and Foundation S are bringing together New Climate and Health Innovation Consortium for $150 million to fund locally led, and that's the key, innovation in climate and health adaptation and resilience. And so that's something I wanted to put on the table because that's going to launch in a few months, $150 million, and it's going to be an opportunity to actually stimulate focused and concrete solutions. So something to watch for. And I think we're good. Alan, did you want to, before Alan comes up, let's give it up for this great panel. And Alan, over to you.
Thank you, Peter, and thanks all of you. Great conversation. When you asked Peter about the state of global health, I was kind of surprised with the pessimism. I think that's, I would say, still promising because of all the, you can't put this, rabbit back in the hat of technology and innovation and other things. And obviously there's a blip right now, but that's challenging. I think when it comes to climate change, I hate to say it, but I'm more pessimistic on that, but I love your optimism on that part. But I want to thank you all for everything. I just do need to do a couple of housekeeping notes here. One is there's going to be a lunch up here right now. So I think they're setting up out there. So please, you're welcome to stay. There will be Devex Impact House news programming going on after that. So please do stay for that. And I want to thank our partners at Takeda. Thank you so much. And everyone here, appreciate it.